chair recognizes Ms. Malia of Boston.
Thank you, Mr. Speaker, and to you, through you to the members. I first would like to acknowledge and thank our Speaker for the leadership he's shown on the substance abuse issues that we're facing in the state. His leadership has really helped make this a priority and helped get us to a point where we have a substantive piece of legislation we can offer you today. Chairman Dempsey and his staff have been unbelievably helpful. The members of the Substance Abuse and Mental Health Committee have done an incredible job. I also want to thank Governor Baker and his outstanding team at Health and Human Services for the leadership and the patience that they've shown us. What we have today is a piece of legislation that combines a number of different elements, but when we talk about substance abuse issues in general, substance use issues in general, we're talking about the need for at least 3, if not 4 things. We're talking about the need for intervention to stop, to try to impede this and slow down the number of deaths that we're having. This public health crisis is unlike anything I think in this state most of us have ever experienced. We need the tools to intervene in the emergency rooms and in our communities. We also need tools to address the need for treatment. We need to also seriously begin to address the education and prevention parts of dealing with the substance abuse crisis. The bill that came out of conference committee yesterday combines, I think, the best of the House's offering, the Governor's offering, and the Senate's offering. One of the first and foremost pieces that's very important as far as much of the discussion has happened is the 24-hour substance abuse evaluation. This evaluation would require hospitals to conduct a detailed substance abuse evaluation for each person presenting in the emergency room with symptoms of an opiate overdose. This must take place within 24 hours. Post-evaluation, patients are given the option to engage in voluntary treatment and be connected to services inside or outside the hospital setting. If the patient refuses further treatment, information on community resources are provided and encouraged, and the patient is encouraged to access treatment. It also requires, and this is an area that there has been quite a bit of concern about, requires parental notification of overdose and mandatory substance use evaluation. Parents are now permitted to hear the findings of the evaluation. Substance abuse evaluations ordered pursuant to this bill will also be a covered service under all insurance carriers in Massachusetts. The next major piece really focuses on prevention, the 7-day prescription limit on first-time opiate scripts. We've maintained the House language in that the 7-day limit on all first-time opiate scripts to adults is implemented. There's a 7-day limit at all times for minors, and that also requires a discussion with parents on the risks involved. And there is a very broad and complete set of exceptions for adults and minors in emergency conditions, chronic pain, palliative care, and cancer diagnosis. We've also addressed the prevention aspect in implementing a partial fill segment, which allows, at a patient's request, a pharmacist to fill a Schedule II drug in a lesser amount than indicated in the script. It allows the patient and to become involved directly in their own care. This also has a proviso that it does not require pharmacists to partially fill. The language is permissive, so they can use their judgment whether or not to do so. Any remaining quantity of drug after a pharmacist fills in a lesser amount will be void. Also on prevention, amended Senate language that requires drug manufacturers of controlled substances in Massachusetts to participate in either a drug stewardship program or an alternative plan as determined by DPH. I think if one lesson that all of us have learned is that we need all the players in this crisis at the table to be part of the solution. The pharmaceutical industry up till this point has been absent, has been unfortunately less than helpful, and absolutely needs to step to the plate and begin to participate and give us the resources we need to deal with this crisis. We also need to start education somewhere in the early grades, with dealing with young people, their issues, and finding a way to begin talking to them about what substance abuse is, and also how far along some of them are. If they've had any exposure to substances, we need to be able to start those conversations at a very early age. So there is an amended Senate language piece here that allows for expert screenings or intervention screenings. School districts will be required to conduct verbal substance use screenings at 2 different grade levels. It also allows for an opt-out provision for school districts that have existing or conflicting screening programs or policy tools. It also allows school districts conducting their own plans for screening to continue to do so without violating the law. Parents will be allowed an opt-out of the screening process. Again, we've spent many hours and an incredible amount of energy discussing the status of this crisis. I want to thank the speaker, the membership, for their patience and for their participation. And when a vote is taken on this matter, I ask that it be taken by a vote of the yeas and nays. Thank you.
Ms. Malia moves when the matter is taken, be taken by a call of the yeas and nays.